Hello everyone, my name is Yoan Petre. I'm from Romania, Bucharest, and I'm very honored and happy to be with you today. Thank you, first of all, Anna, for bringing us all together. Anna, Alex, Martin, and all the teams that organized this event. And before to start my presentation, I will take a recommendation from Tamas relate to organize and find other NGOs. And I'm here to pitching you as NGOs that wants to work with other NGOs from Bulgaria. Because looking what's happening in terms of funding, for us as an NGO, is very important to apply, especially to European funding, as a cross-border network. And Romania and Bulgaria, and Romania and Bulgaria have many similarities. I know before there are some similarities, but today, meeting with Elena and Alex at the checkpoint, visit the infectious hospital disease. By the way, the infectious hospital disease looking the same as a hospital infectious disease in Bucharest. The same floor, the same how the room are organized. It's like I go back home. And when Elena start to story about the Bulgarian situation, it's like I heard it's like someone from Romania talking about Romanian situation. So it was, what? Like this. I prepared something related of HIV patient involvement during the long period of time, we will see. But before, I will kindly ask you to have a moment of silence together for those who are not longer with us. People who dying by AIDS and HIV. Please stand up. Thank you so much. So this is what I would like to communicate, and I would love after to have as much as interactive we can the discussion. So I will present some past, present, and the future about HIV movement in Romania. A little bit about my personal experience and those organizations that I was involved or are still involving in the field. Patient involvement, how is the reality, and patient-centered care, because all of us, we looking to put the patients in the middle of the healthcare system, and Q&A. A little history of HIV. I think many of you heard in the last, maybe when you was young, in the late 80s, early 90s, the epidemiological accident that was in Romania. At that time, Romania was outbreaks in infectious disease that 13,000 children were infected by HIV through nosocomial procedures. Most of those children living in an orphanage, living in institutions run by the states. So yeah, it was very, very difficult time for the medical health provider. They said tender loving care. This is for them years, the only instrument, the only method to tackle this problem. And tender loving care, it was the only instrument that the doctor at that time having. So basically, they use emotional empathy, loving, and that's it. So what happened at that moment? The HIV NGOs start to organize. And one of the first ambassador, it was Olivia Harrison, the wife of the Beatles singer, George Harrison. She came in Romania and she said, let's do something. So in that moment, the first organization, it calls Romanian Angel Appeal. And they start working with those children, especially from orphanage, and trying to find a solution. And then other organizations like ARAS, like UNOPA, like hello, welcome, Baylor Mara Negra, show up and start to fight with the government in order to check and looking for the solution. UNOPA, the organization who was built by the parents of those children that dying, it's built by pain. So at that moment, it was 18, 20 patients organization, those children staying in a hospital, and most of them fighting for every day to survive. 2 weeks ago, we celebrate, we can say, or mark, depends how the angle you look. We have 40 years of HIV in Romania because the first cases was diagnosed in 1985, and we took this moment to create this day. June 10, National Day, put it in the legislation to bring attention for HIV situation in Romania. Why we do that? Because as you know, many of you know, 1st December is the World AIDS Day. But World AIDS Day on the 1st December, it's in the same day with Romanian National Day. So every year we cannot do nothing relate HIV because every institution, any politicians, everybody, it's preoccupied by National Day. So we stay and thinking, we need to do something in order to put on the agenda and another. So we find this and we organize meetings. We launched the manifesto HIV, Bucharest HIV Manifesto, which is very close related with Glasgow HIV Manifesto. It's related with aging with HIV. It's related undetectables means untransmittable. It's detectable. It's related with put the HIV testing much friendly even to the GP, go to the GP and have a rapid test or a blood test, and so on. I give you some statistic relate the people living with HIV in Romania. So the number is 60,000. What is for me, it's concerning, it's those numbers. So we have 50,700 people with antiretroviral treatment, but almost 10,000 are with viral load suppressed. That means the difference between this and this, which is approximately 5,500, they receive treatment, they pick up from the pharmaceutical hospitals, but their viral load it's not suppressed. So there are some kind of transmission, huge transmission, potential transmissions in place. Another important aspect that I want to share with you, it's the age. As you can see, the median age of people living with HIV is young. So those people are between 35, 39, 40, 44, and they are in the middle of life. They have some specific needs like labor market, families, and so on. Find someone to start a business or, you know. But we will see later on, it's a problem in Romania right now. And now we are in the present and looking for the future. And the situation now in the present, it's 80% of people who receive treatments are on a single table regimen, which is in terms of how to say, to be adherent to the treatment. It's a huge step forward. One pills.
Can you repeat? I just didn't hear.
I said 80% of people who receive treatments are on the single tablet regimen. It's one pills. They take one pill. It's this is the language STR. And that's make the adherence to the treatment much friendly. So yeah, and another we hopefully, let's say we will have maybe 100%, but who knows? What's happening in the present, and we should look in the future. It's about the comorbidities that is related with aging, with HIV, because we have, let's say, the virus, it's suppressed, okay? So I'm undetectable, but what is next? It's not the finish. The game is not finished when I'm undetectable and that's it. No, we should look and pay attention to other health issues to prevent other, because we know the people living with HIV getting old, some of the tissues, some of the organs getting old fast than. I put this money, 100 million euro. I don't know how much is in the budget in Bulgaria for. It's a big, it's a small, it's a high. I don't know, but what I want to emphasize, it's 85%, maybe 90% of all those money goes to the treatment. But in this program, we have evaluation, we have regular checkup, we have check viral load, the CD4, and so on. But most of the money goes to the treatment, and still face problem with stockouts. Right now, we have problem in Tulcea. Tulcea is a place near to Bulgaria, and there is a problem with, I discussed with Elena, with generic manufacturer which stop produce one, it's called Truvada, and they stop produce this, and the doctor have to switch to other scheme. Switching to other scheme means a lot of pressure of this budget, this already commit. So will be a difficult time because we see many generic company that choose to close the relation with Romania. I heard in Bulgaria it's quite similar. Who knows? Revise social and assistance support, especially for invalidity pensions. We in Romania, we love to say the social assistance, it's okay, could be better improved. So, but now, due to the lack of budget, the government choose to cut some benefits from people living with HIV. So there will be a big issue when the people remain without money. This is one of the most important aspects relate policy and how community and the patient organization can be involved. We are in the discussion to have a new HIV law. The old HIV law, dated by 2002, doesn't cover the new needs of people living with HIV. So it's time to change the paradigm that was created 23 years ago, and we should adapt by law to the new scientific and what happening nowadays. I put here PrEP and EUPATI, and of course Tamas explained very nice and warm about homeopathy. I'm part of this 8th cohort. I'm the 8th cohort of the homeopathy, and I truly recommending you to go to the site that Tamas mentioned, take a look, and use this knowledge, because personal for me, homeopathy bring me a little bit close, maybe 2 steps to the decisions makers. Because talking with a pharma company, talking with institution, talking with a healthcare provider, doctor, nurse, and so on, taking that knowledge and use it makes us reliable. And when you are reliable, you start to have a seat on the table. Otherwise, they don't so look at you. As Tamas, in your Tamas presentation, I like the first and the scale. It was a manipulation, and then the tokenism and symbolic representation and so on. But sometimes the patient organization are manipulated. So this could make us aware. PrEP, it's about future. We want PrEP in Romania. We need PrEP in Romania, and I will discuss a little bit. This is how PrEP it's perceived, and this is made by a core working package 7. You are 7, Anna, or what the working package are you?
We are 6.
6? 5. Okay. So basically, this chart shows us the community leadership is ready to have PrEP in Romania, but policy, health system readiness, and access, as you can see, it's very, very, very low. We have some pilot projects done by ARAS, Checkpoint ARAS. They have Bucharest, Cluj, Timișoara, Iași, but all these projects are financing by the donor, external donors. And as many of you knows, this month FDA approved a twice yearly injectable pre-exposure prophylaxis medication, and you have just 2 doses per year, which is outbreak in terms of how we look at the HIV infections in the future. Now, a couple of 2 slides or 3 to relate my personal experience. I talk early about the hospitals. Here, it's me and the people living with HIV in infectious hospital disease, Dr. Victor Babes. It's one of the 2 main hospitals, infectious disease. And at the time, I worked for Carousel, and 5 years I spent in the hospital, provide social service and social assistance, those who came in the hospital, and most of them was people living with people using drugs. And as you know, the people who use drugs cannot stay too much time without drugs. So the doctors needs more time to take care of their health condition, and we create some services support to keep them as much as possible to restore the health condition. And we do a lot of activities. Group support is just one of them. And this was a success in terms of create the link between people from the community and the healthcare system. It was, if you want, changing the narrative, how we talk about drug users, how we talk about people living on the streets, who they are. It's, how Tamas said, is just a diagnostic. No, they are people. Nowadays, I work for another organization which is called COPAC. COPAC means Coalition of Patient Organization with Chronic Disease. I'm there for 5 years by now. And we try to do things and take the experience from HIV fields to move to other pathologies. So we are involved in cardiovascular screenings. Here is cardiovascular screenings. Here is a breast cancer project when we run for a race for the cure. Here we organize meetings and train the medical assistant, community medical assistant. It's the ladies that work at the grassroots level in the community, and we prepare them and pack with information related breast cancer, how to identify, how to navigate. We make them navigators. This is the... and I'm back to the HIV and the involvement of patients. You see, I put these fancy rooms. It's a parliament of Romanian parliament, where it was that fancy event that we celebrate 40 years of HIV in Romania. And here it's 100 seats, 100 people attend to these meetings. How many people do you think living with HIV was on the table? I'm asking you. Say a number.
50.
50. Good. Who gives more or less? One. One person living with HIV stay on this fancy table. You see how much work we should done in order to have much more voices. And she have a speech. It was a she. And her speech was at the end of the meetings, instead to start with her speech, because we're talking about, you see? But politicians, yeah. So, as I write there, still need to hard work for a seat. And eupathy could be an instrument, a tool to step in and say, hello, I know what you to talk, you... okay, yeah. This is a chart about the perceptions and how is the reality from my point of view and my organization. And I would ask you to look how is the actual reality and how the aspect and actual reality, you see? So, as I mentioned before, many people living with HIV remain voiceless. Stigma, treatment, there is treatment, but about treatment. I heard in Bulgaria the people could receive treatment for 2 or 3 months if they are undetectable. Is true? In Romania, in Bucharest, you cannot. Just 1 month. And you should go every month to the clinic to pick your medicine. So here I bring some quotes and some reflection for those that I interact and I speak with them. I just stop with the last one. What involvement should look like? Involvement should not just mean showing up to a meeting that I speak before. I want to help shape the agenda. I want my experience to guide better care, not be buried in a footnote. This quote is by Christina. Yeah. We need to measure. We need to see where we fall, where we make progress. But I ask you to look what needs to be changed. Of course, what Romania make progress, it's a lot of things that can be put on the tables, but we need to go further, and we need to have health reform, professional attitude. We need to talking about peer navigators that we need to bring digitalization, telehealth could help. We need to talk more about mental health. Mental health disorders amongst the cardiovascular disease and diabetes are the three main issues that face in Romania, that the people living with HIV face in Romania. Some final tips. The past still matters. Romania have this heritage, this legacy with 40 years behind. We have a very robust healthcare provider, people who is called dinosaurs because they are in the first line at the beginning and they still are there. So all this know-how, all this should be transferred, and people, we will looking at them in order to increase. You know, in Romania, not much infectious disease doctors are. Maybe it's not so well paying, or we have this issue with healthcare provider in infectious disease. Yeah, this is one of my rural versus urban. So it's so huge, the inequity between what's happened in Bucharest and what's happened at 100 kilometers, not so far. We should pay attention to these inequalities and put it in a law, put it in a strategy. Maybe that's why many of them choose Bucharest, choose big city to looking for the quality of services, quality of medical act. Treatment is not the whole story, yeah? Okay, we have treatment, it's a good treatment. Immediately you become undetectables, but we take care to other situations that are not only in clinics, lacking of psychological and social and so on. The NGO sector, and I discussed a little bit with Elena, it's fragmented and it's dying. In Romania, NGO sector is dying because after the withdrawal of the Global Fund that's starting in 2017, yeah, somehow, Romania was not, NGO sector was not ready to access European funding as everybody should. And the states with domestic funds don't show up as much as we thought. So it was a difficult time, and nowadays it's much worse because domestic funds for NGOs doesn't exist. External funders are limited or made by the pharma company, which makes you dependent this area. And the government, Romanian government, don't play fair, taking people from NGO sector, offering jobs and good salary to people that was trained and by others, and they just pick us and inviting to cross the street. So it's not fair. Yeah. That's it, guys. I'm happy to respond to any questions or be in touch. And I put my quote that I have it on World AIDS Day last year. Thank you so much for your attention, for your listening.